Hello and welcome to the channel where we discuss medical topics and lifestyle. In this video today, we are talking about diverticular disease. So what is diverticular disease? In another video that we linked down below, we covered the management of diverticular disease and diverticulitis. But in this video, we are getting into what exactly is diverticular disease and what are these terms that are thrown around: diverticulitis, diverticulosis, diverticular disease. So let's get into the video. So first thing is first, we need to cover some basics. We need to dive a little bit into the anatomy of things and discover what's actually going on. And then we can define what these terms actually are. So let's dive in and define what these three terms are. What is diverticular disease? What is diverticulosis? What is diverticulitis? So these are the three terms that are commonly thrown around. You might hear them. You might get a result from your doctor's office after you do a scan or test, and it tells us this. The main thing to keep in mind here is that we are talking about the large intestine, the colon. So this is the main thing to keep in mind. Now, what is a diverticula? That is a pouch. So it's an outpouching in the bowel wall. These are diverticula, so small bulges or pockets that develop in the lining of the intestine as you get older. Most of the time, they're harmless. And when diverticula cause no symptoms at all, then we are calling that diverticulosis. When diverticula cause some symptoms, we call that diverticular disease. So no symptoms, diverticulosis; some symptoms, diverticular disease. Then, if they become quite inflamed and infected, these diverticula, we get more severe symptoms, and we call that diverticulitis. So these are the three terms, and it's very, very easy to distinguish between the two. Diverticulosis can sometimes overlap with diverticular disease, sometimes when you're talking about symptoms and things like that. But these are the three terms. This is how we define them, and we're talking about the pouches, the diverticulae. So we have defined it. Now let's actually talk about the causes. So what causes diverticular disease? This was the whole topic of the video. So it's not exactly known why some people get diverticular disease, but there are things that can contribute to it. So we'll get to the big one at the end, but age is the first one. So age is a big one that contributes to getting diverticular disease. As you get older, the walls of your large intestine become weaker, and the pressure of hard stools passing through your intestines can cause those pouches, those diverticulae, to form. So if you're above the age of 80, you're most likely to have some diverticulae. Whether they are causing symptoms or not, it's tricky. It's undetermined. We will find that out. But age is a big factor because of that weakness in the wall as the stool applies pressure and goes through. Then we're talking about genetics. So genetics is a big one. You're more likely to develop diverticulae if you have a close relative with diverticular disease, and especially if those relatives have developed diverticular disease before the age of 50. So age and genetics. So these are two uncontrollable factors. That's the main thing to keep in mind here. So yes, you may be a bit more of a risk as age and the genetics plays a role, but you can't stress too much about it because they are uncontrollable factors. Now we'll move into the factors that we actually can control and the big discussion point here. So under the next causative agents, we have diet and lifestyle. So those are the main two things. So if we don't eat enough fiber in our diet, this is heavily linked to diverticular disease. So when the diet lacks sufficient fiber, the stool becomes harder and requires an increased pressure to move through the colon, the large intestine. This then increased pressure, it causes a strain in the wall of the colon of the large intestine. And then ultimately, what happens here is that the increased pressure causes and diverticulae to form. So that's ultimately what is happening. So diverticulae form over time. So this is a lifetime of habits of low fiber, and then this can occur. So that's the big one when it comes to diet. So you get the diverticulae forming. Lack of fiber, heavily linked. You get the pouches forming, the diverticulae, the diverticulosis, diverticular disease. Then you have other factors, lifestyle factors that contribute to it. So it's very similar to other diseases and illnesses, but and quite common sense at the end of the day. But these things afflict many people. So the other lifestyle factors is constipation. So being constipated throughout your life, right? Consistently having this issue throughout your life, it just increases that pressure and causes issues. Obesity, sedentary lifestyle. These are self-explanatory. So these are all linked together. Medication. So if you're consistently taking medication to opioid-based, for example, they cause constipation, common side effects. That's a bother. And also smoking. So smoking also impacts us in a negative way in a myriad of ways, and this is one of them as well. What are the signs and the symptoms of this? Diverticulitis, diverticular disease, related conditions, but they are distinctly different. There are differences between the signs and symptoms. So a breakdown of it: diverticular disease and diverticulitis. So diverticular disease often presents without any noticeable symptoms. So you remember the diverticulosis and the diverticular disease side of things. Many individuals may remain unaware of their condition for a long time, right? You may notice it just from a scan. So the most common things is that it's most commonly asymptomatic. Then we have mild discomfort that can occur. So some people with diverticular disease may experience mild abdominal discomfort, cramps, lower left side of the abdomen, and this can be relieved with a bowel movement or gas. Bloating and excessive gas. So these are issues that may be experienced, leading to feelings of fullness in the abdomen, a change in the bowel habit, right? So you can lead to alterations in the bowel habit, diarrhea or constipation, and rectal bleeding. This is where we start to verge into the diverticulitis side of things, where symptoms get worse. And there we have abdominal pain under the diverticulitis category. So it's quite severe. It's localized. It's in the left lower quadrant, left lower corner there, but it can sometimes occur on the right. Fever can occur. So inflammation and infection, when those diverticulae become inflamed and infected, these things happen. Change in bowel habits, again, similar, but the alterations can occur quite severely. Nausea and vomiting, so this completes that picture of being unwell. And then there are other signs of inflammation. So in addition to everything, you can have an increased white blood cell count, for example, on a blood test. And then you have rectal bleeding as well. So once you fall under the category of having diverticulitis, those kinds of symptoms become more prominent. And I would say those are definitely the symptoms where you need to speak to a healthcare professional. So that's it essentially for this video. Those are the causes of diverticular disease. That is what diverticular disease is. I hope this was a good distinction between the various terms that you commonly hear. When we're talking about the management, please take a look at our other video, and we will see you in the next one. Please leave a comment in the section below, like and subscribe for more, and we'll see you soon.